Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. Now, a lot of people have asked me about Gastrocrom, cromolyn sodium, and how to afford it. Is it really needed? Are there any substitutes, etc.? So here's the lowdown on Gastrocrom and mast cell stabilizers. We have 3 people in our home on this medication, so I had to become an expert at this, believe me. First, why do so many of us have mast cell problems? Now, if you've seen the Driscoll theory, and if you haven't seen part 2 yet, heavens, download it today. You already know that one of the retrospective analyses I conducted revealed that most, if not all of us, have a propensity to develop hydrocephalus upon birth. Now, pressure on the brain causes an increase in inflammatory cytokines and the mast cells that amplify the inflammatory cytokine response. Now, if we still have high intracranial pressure later in our life, we need to first lower that pressure. Most of us have external communicating hydrocephalus, and we're not candidates for shunting. Again, full details in part 2 of the Driscoll theory. But if we're not candidates for shunting, acetazolamide or methazolamide is about our only option for medication to lower our intracranial pressure. Now, does acetazolamide or Diamox cure POTS? Heck no. What it does is it decreases the pressure in the subarachnoid space, which is pushing our brains down onto our cranial nerves, and it's decreasing the fluid pressure in the cerebromedullary cistern around our brainstem, thus imitating the symptoms of Chiari and retroflexed odontoids. Now, reducing the pressure also decreases our level of inflammatory cytokines, which can damage many of our organs and tissues, including our endothelium, leading to the vagus nerve compression if it's bad enough. There you go, part 2. So, mast cells they've got to be stopped. They're bad dudes. They recruit other cells, such as neutrophils, T cells, astrocytes, to spit out more of these inflammatory cytokines. I call them the Ponzi schemers, So if you respond well to H1 and H2 antagonists like Zantac, Zyrtec, you and your doctors really need to seriously consider calming your mast cells with a mast cell stabilizer such as cromolyn sodium or ketotifen, which is available in Canada. Now, Gastrocrom is the brand name for cromolyn sodium, and our pharmacy sells it for about $960 for a 26-day supply. Now, my 2 kids and I both take it, so you multiply 960 times 3 and you get impossible. There is a discount card available from the manufacturer that's good for up to $80 off your copay. That brought ours down about $10 per head, which really wasn't much help for us. So what do? Here you go, my friends. How to save lots of money. You call a couple of formulating pharmacies and ask them if they can get cromolyn sodium and make it into a liquid for you. Trust me, ask them for no fillers, no flavoring. We got a batch once that was thick and sweet, and all 3 of us immediately got our gag reflexes back. Ugh, it was horrible. Every pharmacist is a bit different, but this is kind of fun for them. They get to stop counting pills and work with science kits with beakers and Bunsen burners or something like that, but it is kind of fun. The pharmacist will likely know this, but sometimes your doctor will want to write the prescription with the concentration you need to make it easier. So Gastrocrom comes in these cute little ampules. You take 2 of the 5 milliliter ampules and mix them with water 4 times a day. The formulating pharmacy can make a solution with 200 milligrams of cromolyn per 5 mils. You take 5 mils 4 times a day mixed with some water. So it's twice as strong, so you take half as much. Cool? Now they can give you a measurer, like we could use this little bottle, and the measurer goes in here and you pump out 5 mils. It's really easy. I'd encourage you to price shop a little bit. We found about a $60 difference among a couple of pharmacies per month. So ours is about $90 a month. I hope this saves you lots of money, my friends. It takes a while now before you'll notice its effect because it doesn't kill mast cells, it stabilizes them. But in a few weeks, you may notice that your orthostatic tolerance is improving. Mine improved enough to stand up for a 20-minute speech. I showed the speech to my daughter, and the first thing out of her mouth was, "Mom, are you standing?" Wow, after almost 9 years, and I was standing, and she noticed, and she was happy. I felt like she kind of had a little bit of her old mom back, and I think she felt that too. So, again, my friends, save some money with your Gastrocrom, and we will continue to change the world, one brain cell at a time if we have to. Gentle hugs to you all.